CCSP monthly meeting, and we have people from all across the state joining in. Elsa and I have a few updates to provide, and then we'll have Jen and Jessica from CCMCN talk about population health management tools and different ways to utilize some tech platforms for the screening that we do. So I will share my screen for the updates that we have. Can everyone see that?
Yep.
All right. Elsa, did you want to give your updates?
Sure. Hi, everyone. Nice to see you all as always, and have everyone joining from all across the state. So now that we're just past midway for the fiscal year for CCSP and this being the last year of our current grant cycle, we've been just checking in with everyone to see how things are going. And also I reached out to all of the clinics that are participating in the colonoscopy navigation work to share your current spend down of allocations through December. And if I noticed any discrepancies between the billing total and the valuation total. So working with everyone to make any corrections needed, and then also see if there's any support needs to help you all use all your allocations by the end of the year. But if you're on the lower end of not reaching that 50% mark or getting close to that, please let us know if you feel like it won't be feasible for your clinic to use all of your colonoscopy navigation allocations by the end of June, so that we can redistribute the resources to other clinics or other places in our budget, because our budget every year is a use it or lose it situation. Next year, if for clinics who are continuing on for the CRC screening work with CCSP, it'll look a little bit different. So we won't have to worry about this going forward, because we'll be focusing on all colorectal cancer screening methods. But through the end of the year, still continuing on with our colonoscopy navigation work, and then the stool testing work separately. So speaking of the capacity building work for stool testing, as well as the lung cancer screening and hereditary work, as well as just for clinics who are only doing colonoscopy navigation, we're reaching out to everyone to see if you'd like to set up a technical assistance call for this quarter for check-in and support. Or alternatively, we're giving clinics the opportunity to send progress updates by email instead of having a call if you don't feel like you need that support for this quarter. But if you decide not to have a call, please send us a quick update of how things are going, any progress you've made, or other data points and updates that might be helpful for us to know how things are going and to share with our funder. And then lastly, we have a new quarterly newsletter we're going to be starting to do for the end of this fiscal year, and then continuing on to the next grant cycle with many updates about clinic highlights, resources, data snapshots, and other useful information. So the first one will be sent around March 1st through our Constant Contact platform. I'm going to turn it over to Wesley to share some details about our big March event for Colorectal Cancer Awareness Month.
Great, thanks, Elsa. So this should be on everyone's calendar because it was the March team meeting that we moved to a Thursday to accommodate some speakers' schedules. But if you don't have it on your calendar, let me know. And I'll also be sending out a flyer here in the next few days with registration info. So you can get the date on there that way. But it'll be Thursday, March 9th from noon to 2 p.m. Mountain Time. And since March is Colorectal Cancer Awareness Month, we wanted to host a panel of a few different people speaking about policy updates, updates around the science, updates around implementation of interventions for colorectal cancer, lung cancer, family history screening, and then having someone from the American Cancer Society talk about messaging and information to target the 45 to 49-year-olds for colorectal cancer screening. So we'll have folks from Fight Colorectal Cancer, the American Lung Association, the American Cancer Society, and City of Hope talking about all these different subjects. So I think it'll be a really interesting time to provide some updates on kind of the state of the science and policy around colorectal cancer, with also some lung and family history in there as well. So let me know if you don't have that on your calendar, and then disperse the flyer once it comes out among your networks, because we'd like to have a big group here learning from all these national experts. With that, I will stop sharing my screen and then briefly introduce our speakers today, and then let them talk about, give a broader introduction and kind of prime what they're going to be talking about today. So we have Jen and Jessica from CCMCN talking about population health management tools and how to use them for cancer screening initiatives and kind of best practices. But Jen and Jessica, I'll let you guys share your screen and then get on with your presentation. And we'll monitor the chat in case there are questions and let you know.
Awesome. Thank you so much. Hi, everyone. And I want to go ahead and just make this big public apology to Jessica. I asked her to join this call yesterday at like 1 p.m. So she had plenty of time to prepare. So I want to go ahead and apologize for that. But hi, everyone. I'm Jen Ammerman. I work for Colorado Community Managed Care Network, or CCMCN. We are not a managed care network. We are actually, and I'll actually share my screen, a health center control network designated by HRSA to support FQHCs, but our let me see, let's see, I don't know why this is doing this, but our, can you see, sorry, can you see my PowerPoint?
I can see your PowerPoint, and then if you
Okay.
go to the like the display as slideshow.
Yeah. Awesome. Sorry, it's showing that I'm sharing my other screen, so that's
there.
good. Great. Yeah.
Yes,
So this is our contact information. We work with FQHCs, but we do also support other organizations. So I will go ahead and pass it over to Jessica to introduce herself.
Yeah, hi, good afternoon, everyone. My name is Jessica. I am the Care Coordination Manager at CCMCN, but I manage our Health Cloud Care Coordination platform, which we'll actually talk about in just a few minutes. So excited to be here and talk with you all.
So I think we had a pretty loose agenda, which was just to describe the population health tools that we utilize, what we support. Interesting enough, I mean, from my perspective, I don't have any patients. Jessica actually has a little bit more responsibility towards patients. That being said, we do support the health centers or the FQHCs in the state of Colorado with data collection, clinical quality reporting. And from there's a lot of tools within the platform we use to track patients, to track care gaps, cancer screening gaps, understanding what patients need. And so we just wanted to do a quick overview of that and Health Cloud. So once again, CCMCN, we are a health center control network, which means we support FQHCs. Our big focus is on supporting all the safety net providers in the state of Colorado. We don't currently do that, but I think we have a huge goal of really expanding and just supporting all, whether it's Medicaid providers or just folks that provide care in places that it's hard to do so. And then in addition to that, we work with not only FQs, but BHOs, OHI, CDPHE, rural health centers, you name it. We want to work with them. We utilize many HIT tools, but we're going to talk about Azara Drives, and Health Cloud. So first, I'm just going to do a really quick overview. I'm not going to read all of this. I just put this in here so we can send the slides out later. Drives is a clinical quality and reporting tool. It takes a copy of your EHR data in a structured way and throws it into this platform that's visually appealing and also pretty easy to use. And the great thing about Drives is that you can see a reflection of what's in your EHR, which is considered the source of truth, but it's kind of laid out in a way that you know exactly what you're looking for, where you're looking for. You don't have to necessarily dig through a ton of notes. Everything kind of populates in 1 to 2 to 3 screens. So that's been a big benefit to a lot of our health centers. It's great for tracking performance, for identifying patients with care gaps or just care gaps in general, and really doing targeted outreach. So if you know that there's a specific population, maybe they speak a certain language, maybe they have certain barriers, you can outreach those patients and maybe do additional follow-up with those patients, kind of targeting, putting your time and effort in the places that you think are most beneficial. And then in addition to that, health equity is the conversation all the time. There is an opportunity to address trends and identify patterns that may be perpetuating health equities in your clinical services. Also tracking for PDSAs is really lovely to really understand outcomes and improvements. And then of course, it's a data visualization tool. So you can create reports such as these. These are just 2 screenshots that you're able to see kind of at a 10,000 foot view, you know, how your clinic is doing. You can break it down by locations. I know that it's hard to see this, but I'm actually going to go into the demo environment. I just wanted to put a couple screenshots on here. So these are 2 different dashboards, and you're able to do the dashboards or customize the dashboards. So I am logged in currently to the, and I don't know if you can see my screen. So let me share it one more time.
We can see it.
Mhm.
Wrong screen. Wrong screen. Okay. You can see drives. Okay. So I'm
Yes.
logged into a demo environment. So fake people, fake organizations, fake patients. So this is what you would see when you log in and what our health centers would see when they log in. I know that this is we're really trying to focus on cancer screening and cancer prevention work. So there are like 600 measures in here, but we can really drill down and focus on UDS cancer screening, or cancer screening, not necessarily UDS, cancer screening measures. So for instance, this is an example of this dashboard that I just shared. It's able to identify from your patient population, all of those patients that are, how you're performing when it comes to the different cancer screenings. You can change the time period. So if you want to look at, this is a demo environment, so it doesn't show you, but if you want to look at more than a month, you want to look at a trailing year, you want to look at the current calendar year, you can do that sort of breakdown. In addition, you can break down by providers, by specific care teams. You're able to really group the folks in your team however you'd like, and then kind of take ownership of those scores in the individual clinical teams. Service lines, you can make it all service lines. You can really focus on your primary care providers. It really doesn't matter. And then in addition to that, if you want to drill down into them, so let's see, let's do colorectal cancer screening. If it loads. Here you can actually look at a breakdown of that specific measure. The nice thing about Azara is that we pay Azara to keep up to date for measures. They're not 100%. I would say they're like 99% up to date. But it's a great way to really know that you don't have to update your EHR. The data gets pulled in, normalized, and then you know who to target. So for example, this is just an overview once again of your clinic, but if you wanted to drill down to the patient level detail, you're able to see that in the measure itself. So once again, for something like colorectal cancer screenings, it's not really something you can just bring someone or have them come in for their regular appointment and say, hey, like, let's do a colonoscopy or let's do a FIT. But the one thing that you can do is identify patients that are in the gap soon. We will do that in the gap and may have an upcoming appointment. So I can do gaps and then next appointment. And here I can identify all these folks that have an appointment. So if I just want it to be people that have an appointment, I'll select all, I'll remove blanks. And here's a list of patients that we can act on, right? So I can get them a FIT or Cologuard or, you know, whatever it is that they qualify for when they come in, so that potentially they can return it and get this screening done. Of course, this may also be a great opportunity to identify patients that are uninsured and overdue, and maybe see if they're a good candidate for history of good candidates for maybe some sort of funding or support that your clinic may be able to offer or may be able to find in the community. So it does have a lot of information when it comes to the history of the patients. When their last colonoscopy was done, it looks like none of these patients have colonoscopies. But, oh, here we go. Oh, sort of. So in short, it's a great way just to look at the information you're interested in seeing and not having to look into the EHR. So I'll just quickly move from here. So of course, the gaps are identified in the measures themselves. You can create customized registries and reports and scorecards. You can actually identify a list of patients. So for instance, we just had the overdue patients that had upcoming appointments. You could create a cohort called upcoming appointments February 2023 and put them in a registry to identify ways you contact them or what languages they speak and things like that, and just really decipher or siphon them out rather. And then in addition, there's this PVP tool, which is patient visit planning tool. Our organizations typically use this a lot. It's kind of reminiscent of a daily huddle. You can pull it for the future, for the past, or for today, and it's going to pull up all the patients that were scheduled as of this morning. Here, yeah, I will just add a filter right here called alerts, and the alerts will let me, if it loads, the alerts will let me identify patients that have just the specific care gaps that I'm interested in. Looks like my computer is like gonna die. Okay, here we go. Alerts here. And I just want to identify patients that are overdue colorectal, cervical, and breast cancer screening. You can update that, and then the patients will populate. This is just for one day today, so we may not have any patients in this, but oh yeah, we will. I saw one PAP at least. So here you can see this patient has the alert for a PAP, HPV screening that's necessary. Here we have a colon cancer, and then here we have another colon cancer and a mammogram and a PAP. So it's a great way to really identify the patients that are coming in today even and just addressing those needs as they walk through the door. And then last, I know that this program is really focused on, tracking and follow-up. So there's 2 additional reports in here that have been useful for that. One is open lab orders. So interesting enough, I already went into the demo environment. Nothing's populating in open lab orders because of this demo environment, but this would show all the open lab orders for your FIT DNAs, your FOBTs, cervical cancer screening, and then not breast cancer screening because it's not a lab order, and not colonoscopy because not a lab order. But it's a nice way to follow up on FITs, cervical cancer screening, and yeah. And then last, we have completed lab volume. So if you're really making a big focus on getting FITs completed, doing a ton of colorectal cancer screening education, you can do the same here. So you can identify by the specific work that you're doing, and then update the list to really see how many of these have been completed. And you may want to put your date range longer than a past week, because yeah, but here in this case, this fake network had 21. So yeah, that is my overview of Azara. So I will pull up my PowerPoint again and hand it off to Jessica, unless there's any questions.
All right, I will go ahead and jump right into this piece. So one other thing that we wanted to highlight during this call is just a population health management / care coordination tool that's actually utilized within Northern Colorado. And you guys might be familiar with it. It's called Health Cloud. It's powered by Salesforce. It's a really great application that can really be built for any organization. It could be, as robust as full-blown care management solution, or it could be simplified, down to just creating patient lists to help track specific outcomes. The workflow in this system is mostly automated and can be customized to really fit the need of whatever the end user is really looking to create. Health Cloud can ingest unlimited data such as clinical data, patient lists, gap reports, all that fun stuff. And essentially the backend automation can then take all that data and generate care plans, which can create tasks that help target the desired population, along with helping to support a particular outcome that there might be. So for example, if the system ingests a gap report, it could identify that subset of patients that need a cancer screening, and then our backend automation can take that, generate a workable patient list, and then that can help the end user just prioritize outreach or help with scheduling needs if that might be the case. So a lot of really great things that can be done there. Health Cloud can also ingest unlimited populations and assessments in the system. And there are several integrated applications we actually have within the main Health Cloud application, such as the Find Help referral tool, which helps with just closing the loop on those social determinant of health referrals. And then we also have Tableau reporting in there, which helps report out on any data that's brought into the system. And one other thing I do want to highlight on this slide is we do have EMR connectors in the works. We constantly hear that there are all these siloed systems and there's no way for them to talk to each other. Someone's using one system because it works best for them, but another might be using an EMR that works better for them. So we are bringing in these EMR connectors that can really create that seamless bi-directional passage of information. So those that are utilizing the EMR can still pass their information to, case managers, CBOs, those individuals that might be within the Health Cloud platform. So a lot of really neat things coming up in terms of that. And then on this next slide, Jen. So one big component of Health Cloud is actually care planning. And just to kind of set the stage with that, a care plan is essentially a list of tasks that are generated within the system based on patient needs. So here you can see some examples of like a MAP treatment program, for example, and just seeing how we can generate specific tasks for them to work, give them a workable, actionable list for them. And the really cool thing is that these care plans can be as simple as a single task that might identify the need for a cancer screening. So, helping to get outreach for that piece scheduled, or it could be as complex as 15 patient-centered tasks that focus on not only medical needs, but also those social needs that come from the individual. Care plans also include stuff such as time tracking and documentation. So just a really great way to put everything into this main person account and have it all just live in the system. And these are just some screenshots of what that can look like in terms of the user interface. And then my last slide actually talks about the reporting side of Health Cloud. So, part of population management is not only having access to that data, but it's being able to report out and kind of identify trends and outcomes. So Health Cloud actually has the ability to generate reports on what actually happens within the system. So for example, we can track how many tasks are closed in a certain way to see how many individuals were successfully helped. These screenshots here show how we can actually create reports based on whoever's logged into the system. So we can create these organizational views for like a supervisor, for example, to show like, hey, give me all of these tasks or all of these outcomes on this population for my entire team. But we can also generate individual reports. So the specific nurse, care manager, staff member, they can look at, hey, what's my productivity for this month? What are my outcomes looking like? So a lot of really neat things we can do with actual Health Cloud reporting. And then, as previously mentioned, we do have the ability to build and embed Tableau reports within the system, which allows us to not only take the data that's put into Health Cloud, but we can also take information from our data warehouse on the individual that maybe comes from, claims or EMR data, clinical data, all that stuff. And we can generate this full picture of that patient population to make that visible in that single interface. So a lot of really great things that can be done within Health Cloud, not only on gathering data, but also then reporting out on that data. And that is my super speed version of what Health Cloud can do.
Awesome. Thanks. So want to open it up for questions. Did you guys have anything else to present there?
No, no, there's nothing.
Okay, I just wanted to make sure I wasn't cutting you guys off. So yeah, thanks for kind of giving the overview of how these different population health management tools work. I want to open it up to questions for the clinic. I know some of these folks are FQHCs, some might already work with CCMCM, but have any questions for these two while they're here. If not, I have some questions. But yeah, I want to open it up to the group first. All right, I guess one of my questions is, in all the folks that you all work with, what are some of the best practices or really interesting ways that you've seen people incorporate the use of these dashboards into their daily or weekly workflows? I think we had some questions about processes and best practices there. So if you have any sort of thoughts on how that works at different sites, that would be great.
Jessica, I guess I'll go first, even though I think you'll probably have a better answer. So for at least for Azara, we do see that it's heavily focused on, clinical services, but it is also such an easy tool to utilize when you want to just see who to act on in that moment in time. So I think that one of the ways that, and I brought it up on the screen, one of the ways that our health centers utilize it is through the PVP. It's a everyday tool. The patient visit planning tool is that daily huddle tool, the review tool. Organizations print it out and highlight patients that need to be addressed. Organizations will download it or review it every morning and just put a note on their calendars. This patient needs this patient needs this intervention, whatever. So that is probably the creme de la creme of just utilizing it daily in a workflow. And then the other opportunity is, because the data is tracking what needs to be done today and has been done yesterday, it's really a nice way to see how your team's performing. Maybe certain providers are just not doing what you're asking them to do. I think in the data, you start to see that. So I love having something to, I love getting mad at people, but I love having some data to back me up on why I think they're doing a real crap job. So that is, I think, also something that's pretty applicable. And then Jessica, I know you have way more to say.
Yeah. So in terms of, we work very heavily in like Northern Colorado, so like Ray 2 area, and we basically get all of these patient lists that then Health Cloud will take and trigger those care plans in the system that give them these workable, again, just lists of things they need to do, like outreach, helping maybe lower ER utilization, that kind of thing. So there's like these subsets of population that we're focusing on. A big one is being the complex patient population. So those that, have high medical costs, a lot of different medical needs, that kind of thing. And the system, they're essentially able to just put in their outcomes, whether it be, hey, I contacted this person and they told me to go away, so we really can't report much out on that. Or, I contacted them, we met all of our goals for this care plan. Now we can report that out on a monthly report to the Ray, for example, and show them all this great work that we've done. And here's exactly how we've done it. So a lot of really great things with just that automation that we've built for the care plan side of it, that then can get the care managers we work with to actually put their data in, say exactly what happened, what that outcome was, and if they discovered any other needs from there, and then reporting that back to the Ray.
And Jessica, I just want to say, because I don't think about this with Azara, but for Health Cloud, you're able to really understand capacity, right? So your clinic's capacity, your workflow's capacity, which is not something that a lot of other tools are able to see. Like, how much did I spend with patient X, and how much does my other teammates have to spend, and do I have a higher panel size essentially, and is my panel way more needy, and things like that. So there's this additional element of management, right, that just makes it really lovely.
Yep. Yeah. Time tracking, I know, is a big thing, being able to see it not only from what the end users are putting in, but also in terms of on a patient level, how much time are we spending with this patient versus other patients? And then how can we essentially assist them and make it just better in that workflow fix? And then also within Health Cloud, when they do get these care plans generated, we have like a round robin approach where it's like, hey, these people are on these teams, so they could get, all the BH care plans or the ED high utilization care plans. And we can assign those out to make sure that everyone is getting just an even workflow, because I know that can be a little bit tricky too, is finding that balance between making sure you don't overwork someone that's on one team, and that balance is really nice because the automation can build it out and round robin it out.
Awesome, thanks. We did have one question that says, does any of this data interface directly into ESSET, ESSETT. And I don't know if that's a different population management tool or EHR.
It's a care coordination tool, or
Okay.
care management tool, but Jessica, I don't have the answer. I don't think Azara does.
So in terms of getting all of the different like EMR connectors that we're working on, I know that we are focusing on different care management tools as well as just the different EMRs that would be beneficial for us to be able to connect with. So right now we don't have anything that's directly interfacing into it, but that is part of the process of building that bidirectional feed utilizing those EMR connectors.
Thanks. Any other questions from the group or Andy or Elsa?
And Wendy, you might have mentioned this ahead of time. Sorry, I was on another call. But Jen, if groups aren't connected with you right now, but are interested in working with you all, in terms of really thinking about the engagement for the data and lessons learned. Again, you might have mentioned this, but if there's like a clinic system that we're working with who isn't maybe an FQ or connected with CCHN or with even the Rural Health Center, I mean, is there ways and inroads to get connected with CMC and like how you all, in terms of how you're established and set up, what does that look like?
Yeah, I think there's always a way to partner. I think the drill down is, what can we provide and how much does it cost, which is always like a tough conversation. But from a perspective of just kind of being part of knowing what's going on and maybe also optimizing the systems that they do have or finding opportunities for them to connect in general. Yeah, I mean, I would just suggest send an email out to me or to Jessica. We'd be happy to contact, I guess it'd be our COO right now, Michael Feldmiller, to see what kind of partnerships could exist. There are a lot of resources in the Colorado community. In fact, I don't always know what Jessica's doing and Jessica doesn't always know what I'm doing because there's just so much going on. And I think we're a little bit plugged into a lot of it. So I think we'd be happy to be a support. There also is a lot of opportunity for funding that just seems to appear and then sometimes disappear. And so I think it's really smart to understand what the needs are for organizations across the state, because when an opportunity for funding does arise, it's nice to just be able to address, recall, this regional health center or whatever needs this, and here's this big money pot to tap into. So I think that also allows for a lot of opportunity. And then last, we don't have a ton of experience. We did connect with a lot of the rural health centers for the COVID work because there was a bunch of COVID money. But I think that just like establishing some sort of structure where there's a level playing field when it comes to the tools that organizations are able to use, and you're not seeing that huge disparity between, Metro Denver or like Metro Colorado Springs versus, like Alamosa. So I love Alamosa, but I'm just saying, reach out to us. I put my email and Jessica's email in the PowerPoint that I will be sending to y'all, and I'm sure you'll be dispersing it.
Mm-hmm. Yeah, we can put that in the email we send with the link to the recording and everything. So we'll have that contact info.
And Jen, I think your point about like there's a lot of funding coming out in different ways to support. I would just say to you and Jessica, given our collaboration on the CRCCP project as well as CCSP and with the clinics, if there's ever an opportunity to do something from a program standpoint or as a technical support partner for our systems, that's something that I think we could either jointly come in together, or if there's a way for us to disseminate that information, we're happy to do that as well. We, with our CCSP navigators and FQs, rural health centers, we can help serve as a dissemination, maybe even provide people data and information to either be independently successful, or if there's a way that, again, from a network. And then we also help lead out a statewide alliance for community health workers, navigators, and different networks. So if that's something that could be a benefit for you all, we'd love to continue the partnership too.
Yeah, I think the minimizing any kind of duplication of work, which I mean is hard because everyone needs something very unique, but just minimizing the duplication of things that are already being done, and then communicating across the state and having everyone that needs to create a solution for themselves kind of be on board. I think that's going to really make sure that when we create a solution or we opt into a specific tool, it is something that can meet the needs of a bunch of others. And I would just say, I'm just going to say this out in the world, I have a huge desire, Jen Ammerman, not CCMCN, that CCMCN gets more acquainted with the regional health connectors. So if y'all have any ties with that, I'd love to talk more about that too, because I do think that a lot of the work that Jessica does could be really expanded and be of support to those regional health connectors, especially when it comes to resources in their community. So yeah, that's it. That's all I have.
Definitely. And we can help make some of those inroads too. So.
Mhm.
One question that I have is, so many of our clinics on the call are FQHCs, but for those that are not, maybe you could give a flavor of some of the technical assistance and types of support you provide to FQHCs, so some of those other groups could start thinking about how this could be helpful.
Yeah, so for Azara, we have a commitment to support the health centers in clinical quality reporting. That's APM, that's UDS, that's sometimes things that are connected with arrays. And currently our big focus is that our platform that we pay for, Azara, is utilized at the FQHCs. All of the FQs have access to Azara except for Sheridan at this time, and they're going to be implementing this year. So we're really excited to have that network of data. And the work that we do is, one, we try to support data hygiene for all the reporting that every health center has to do, very much so tied to these cancer screening measures, making sure the documents that have come through Contexture or QHN are being are put into their EHRs in such a way that the referrals are being resulted and the information's there. So if something is in the nitty gritty is that kind of workflow. In addition, we support reporting. We do the APM reporting for the health centers. We do have patient level data access, so we can see their patients. We can support in doing validation work. We can do reporting for them. We can create automation for them. We can add users for them. So we do a lot. I think a lot of people on this call probably had me on a call doing that kind of in-depth TA. And then in addition, specifically CCHN, who's not on the call, I think, but we're working really closely with CCHN to ensure that we're supporting webinars and really addressing solutions to things that people find themselves in. So for instance, patients at a medical home recently had some additional measures that they required health centers to report out on. We advocated for Azara to add those measures to their basic subscription so that health centers could support that NCQA deliverable. So those are the kind of things that we do. Very boring stuff. Yeah. And Jessica, I don't know if you have anything you want to add.
Not really. In the Health Cloud realm, we can essentially build whatever workflow there might be for someone. We go through a pretty in-depth workflow analysis and try to build out the best build for the individual, which of course we're always happy to have those discussions about. But we work very closely with, Ray 2 in particular. Some of these individuals on the call probably also know me because you see plenty of emails coming from me to your center talking about all fun things with Health Cloud.
And I would just add one thing where we have a broad idea this year that we're going to be doing webinars and really sharing some of the work that we do, because I think a conversation happens is, what do you guys do? And what do y'all do and what do you have? So this year, I know that we have a focus on really demonstrating the Health Cloud, the care coordination work. It's part of our HRSA grant, actually. We said we were going to do some webinars. So I think that's also probably a pretty good opportunity to get involved, is just to we don't have really a newsletter yet. Maybe we do. I don't think we do. But just reaching out to us and saying, hey, when y'all do this webinar, I'd love to see it. Or when you do this demo, or could you do a demo of Health Cloud for me? Or could you do a demo of something else? I think that's a really good way to do it. We're not like a business that has a service that we sell. We're just this nonprofit of a mess that seems to have a lot of really expensive equipment
Way to own it. I have to admire that.
Great. So going to give another moment just in case some of that discussion prompted any other questions from the group. All right, if not, we can log off early and give everyone 15 minutes back. But yeah, thank you so much for giving an overview of the Zara and Health Cloud. I think it was really good to hear the conversations about what you all do, and we can share some resources. If you have webinars that are coming up, let us know and we can distribute those in our upcoming newsletters. And then I know that Andy and probably Elsa and I have connections to regional health connectors. So if you, we can get those linkages up. But yeah, this was super helpful. Really appreciate it. And if anyone has any other questions for Jen or Jessica, their email will be in the follow-up email. Awesome. All right. Thanks so much, everyone. Hope you all have a
Thank you,
good day.
everyone.
Thank
Bye.
you.
Thanks, guys. Bye.
Thank you.